My name is Barry Stein. I'm the president of the Colorectal Cancer Association of Canada, and I'm also a patient who was diagnosed at the end of 1995 with advanced, actually, colorectal cancer. Every patient remembers starting chemotherapy and that feeling of being nauseous and wishing that they didn't have this huge side effect, which really makes you question whether or not to continue with your treatment. When we talk about antiemetics, that's what we're talking about, quality of life, because having vomiting sessions and feeling nauseous all day is really what prevents you from interacting with other people and from having a regular day either at the office or at home. So we really are talking about the quality of life of patients. Anything that you can use in order to reduce the side effects of chemotherapy are welcomed by patients. There's no question about that. It really encourages and helps the patient and helped me in order to continue my full course of treatment and to benefit from the therapies that were given.
My name is Jean Stutzman, and I had breast cancer approximately 5 years ago, but I am now considered a survivor. Obviously, my husband, who, because I was so weakened by the chemo, he was on cleanup duty. And obviously, my 6-year-old daughter tried to help, but her method was to find ways of being neat and clean about it all by setting up little vomit stations for me. My nausea and vomiting was rather severe, to the point of being projectile. And unlike other episodes that I've had in my life, this was so severe that I really honestly didn't have the energy or the ability to even make it into a bathroom. I spoke to my doctor about the nausea and the various side effects I was having. And he did recommend anti-nausea medications for me. Nausea and vomiting is easily controllable, and there is absolutely no need to suffer. Chemo is enough of a journey, and any time you can make the road easier for yourself, that's what you absolutely have to do.
I had to go through chemotherapy, and one of the first side effects that happened was the famous nausea and vomiting. It takes away all the pleasure of life. It takes away the pleasure of eating. And the problem with this is that if you're supposed to get better and to heal eventually, and you're not eating, you're kind of going backwards with all this. I just threw up all over the place, on me, in the car, in the door, in the street, and I could see people driving by me, and nobody stops because this is not very encouraging. Nobody wants to be caught in that situation. I think the worst about the nausea is that it isolates you. That's the first thing I was doing, isolate myself. Like a wounded animal, you go in your corner and you almost say, let me die. You don't want to talk about this because you feel ashamed. You'd like to be the perfect patient. I don't think we have to suffer through the nausea and vomiting thing. I think we should talk to our doctors. I'd say go talk to the doctor the minute you feel that you're having this and it's being a problem in your life. It's stopping you from eating or stopping you from having a good day or stopping you to see your friend, because I think having your network of friends and family is important into the healing process.